Homes in Rhode Island flagged for infection control violations before the pandemic.
NBC 10's Tamara Sakarzik made the discovery while combing through federal citations. She takes a closer look at whether those violations could have contributed to the widespread outbreaks.
About 80% of coronavirus-related deaths in Rhode Island have happened in congregate care settings like nursing homes. I discovered 11 of the nursing homes with coronavirus cases have been cited for infection control deficiencies over the past 2 years.
The number one deficiency in nursing homes before the pandemic were infection control issues.
Numerous staff members failing to wash their hands, healthcare workers entering contagious patients' rooms without the proper PPE, and residents forced to wait 3 weeks to take a shower. Federal records analyzed by NBC 10 exposed several nursing homes in Rhode Island were cited for infection control deficiencies well before the coronavirus crisis.
It looks like close to 30% of the nursing homes in Rhode Island had been cited for some form of deficiency with respect to infection prevention and control.
Attorney Anthony Leone told me those deficiencies can range from the seemingly minor, like not practicing proper hand hygiene, to the more serious, failing to implement preventative measures during an infectious disease outbreak. 23 of Rhode Island's 81 nursing homes have been cited for such deficiencies over the past 2 years. Many of those same facilities have also had coronavirus outbreaks.
No one wants to have any deficiencies whatsoever, but as I say, they're automatically addressed immediately.
Rhode Island Healthcare Association President Scott Frazier told me he doesn't believe there's any connection between pre-pandemic violations and the current crisis, pointing to a recent report.
The most recent report that the Government Accountability Office came out with just last month showed that Rhode Island was best in the nation in infection control with a rate of only 3.8%.
That report cited numbers from 2013 to 2017, but we looked at numbers from 2018 to 2020 and found over 20 infection control deficiencies at nursing homes. So doesn't that suggest an increase?
What I can tell you is anytime there's a deficiency in any nursing home, it has to be addressed and addressed quickly, or else they're not able to continue operations.
That report showed 3 nursing homes in Rhode Island were cited for infection control deficiencies in 2017. We found that number jumped to 14 in 2018 and 13 in 2019.
Those numbers don't show the full picture.
We spoke to a nurse from one Rhode Island facility that has had nearly 50 COVID-19 cases. She didn't want to be identified, but says nursing home employees take infection control extremely seriously.
We are held to a very high standard of infection control on an ongoing basis. We are annually inspected and routinely inspected, and we report all outbreaks of infections to the Department of Health. So we are well prepared to deal with the typical infections.
But she says this virus was anything but typical, blaming a shortage of PPE and lack of testing for the outbreak, issues that people on all sides of the debate seem to agree with.
Challenges with infection control, not enough protective equipment available. This really is a perfect storm of what can happen.
Tamara Sakarzik, NBC 10 News.
There's a big concern now, scrambling for staff. As coronavirus cases surge at area nursing homes, employee numbers are dwindling.
And these open positions have become increasingly difficult to fill. NBC 10's Tamara Sakarzik zeroed in on why.
Nursing homes have had staffing issues for years now, but this pandemic has only made matters worse. And now the industry says it's in the middle of a staffing crisis.
Every one of our nursing homes has open positions.
From Providence to North Providence to Tiverton, a quick internet search reveals hundreds of open positions at Rhode Island nursing homes, fueled by fear over the pandemic.
Some staff left. They were concerned about catching COVID and bringing it home to their families. They might have elderly parents that they care for at home or their children. We had some staff members retire early because, again, fear of getting the virus.
Federal data obtained by NBC 10 shows staffing shortages in Rhode Island have doubled in just the past 7 months. About 16% of nursing homes ranked below average for staffing in May. Now, 34% of facilities are facing staffing shortages. Just take a look at this graph. The red line represents shortages of nurses and CNAs in Rhode Island facilities. The purple line represents the national average.
It's a supply-demand issue. There's just really not enough people out there even applying for these jobs right now.
Westerly Health Center Administrator Jennifer Campbell says they've only had about a handful of COVID cases, but have seen about a dozen staff members leave in recent months.
Having them all leave in this
short time period, because we're talking spring to right now in the fall, what has the impact of that been on the facility and the residents there?
It's really affected the way that we operate. There's a lot of expectations, and so now trying to get all of that done with the staff that you have, it's hard.
Facilities actually now need more employees than ever to avoid cross-contamination between units and lower the risk of spread.
In a perfect world, you'd have dedicated staff to every unit. But again, when you are limited, you're limited.
That has forced burned out employees to pick up extra hours, something that Campbell worries will only get worse. With little financial incentive, vacancies are taking weeks to fill.
A lot of it has to do with the wage scales, I feel. You know, with the Medicaid reimbursement is not there for us in this industry, and it doesn't support the ability to really pay what these people should be paid for the work that they're doing. It's physically and emotionally demanding, and it's hard, and this isn't something that people want to go into right now.
Under the Medicaid Inflation Index, reimbursement rates are supposed to increase by 3% in 2021. The proposed state budget slashes that to just 1%, which Governor Raimondo continues to stand behind. In the studio, Tamara Sakarzik, NBC 10 News.
We are very concerned about what the funding future will look like for nursing homes.
Rhode Island Healthcare Association Executive Director Scott Frazier is sounding the alarm on nursing home funding as facilities continue to grapple with the coronavirus pandemic.
Over the last couple of months, we found that staff have chosen to leave because they're concerned about contracting corona or bringing it home to their families.
That just one of the many challenges prompting Frazier to call on the state to boost Medicaid funding. About 65% of Rhode Island nursing home residents are covered by Medicaid. Funding has not kept pace with inflation for years.
By saving money for the state budget, it puts our nursing homes in jeopardy because we are not being fully funded.
Medicaid funding in Rhode Island used to be based on the actual cost of care.
In 2012, a state law was passed that said the Medicaid reimbursement must go up by something known as the Medicaid Inflation Index. That changes from year to year. It's a nationally set index, but on average, it's about 3% each year. And every year, except for 2016, the sitting governor in Rhode Island has cut that Medicaid inflation index as a way to save money for the state budget.
We discovered this year the index calls for the rate to increase by 3%, but the proposed state budget slashes it to 1%. When we asked Governor Raimondo's office about the cut, they said it's, quote, the same rate increase proposed in the fiscal year 20 budget, which the General Assembly accepted.
From our point of view, that money is saved on the backs of our residents.
A cost report submitted to the state shows the industry lost $7 million in 2017 and 2018.
When do we need it?
Even as unionized nursing home workers are demanding higher wages and mandatory minimum staffing levels.
The bill that we're advocating, it includes safe staffing, but also wage pass-through so that when there are increases in the future in funding, that a portion of those be dedicated to the wages of caretakers.
According to the Federal Bureau of Labor Statistics, nursing assistants in Rhode Island made an average of $14.25 an hour last year. The bill filed by the union failed to pass the General Assembly, but the fight is far from over.
The industry does not function without caretakers.
Frazier told me the industry can't afford to meet union demands without a boost in Medicaid.
Because if that comes through, then we can continue to pay our staff what they deserve and try to bring in more staff with incentives.
The state recently created a commission to study nursing home funding and staffing requirements, including how nursing homes are reimbursed. The commission must have a report ready by April 15th. In the studio, Tamara Sakarzik, NBC 10 News.